The way of learning. Today's topic is sickle cell anemia, exhibited for stubborn interns. Sickle cell anemia. First question is sickle cell anemia is option A autosomal dominant inheritance, option B X-linked recessive inheritance, option C autosomal recessive inheritance, option D X-linked dominant inheritance. Correct answer is option C autosomal recessive inheritance. Next one is one of the following disorders in which an abnormal hemoglobin leads to chronic hemolytic anemia with other clinical manifestations due to point mutation of DNA. Option A thalassemia, option B hemophilia, option C hemoglobinopathy, option D sickle cell anemia. Correct answer is option D sickle cell anemia. Next one is which of the following is not a participating factor related to pain crisis in the child with sickle cell anemia. Option A stress, option B trauma, option C infection, option D fluid overload. Correct answer is option D fluid overload. Next one is what is most important step to avoid the sickle cell crisis. Option A hourly BP monitoring, option B oxygen saturation monitoring, option C hourly offering water to drink, option D cooling by fan. Correct answer is option C hourly offering water to drink. Next one is the nursing management of a patient in sickle cell crisis includes option A platelet administration and monitoring of complete blood count, option B blood transfusion and iron replacement, option C bed rest and heparin therapy, option D aggressive analgesic and oxygen therapy. Correct answer is option D aggressive analgesic and oxygen therapy. Next one is symptoms of sickle cell anemia result from option A increased blood cell destruction, option B deficient coagulation, option C low blood viscosity, option D low affinity to oxygen. Correct answer is option A increased blood cell destruction. Next question is sequestration crisis is related to option A pernicious anemia, option B sickle cell anemia, option C aplastic anemia, option D iron deficiency anemia. Correct answer is option B sickle cell anemia. Next one is the home health nurse is visiting a 15-year-old with sickle cell disease. Which information obtained on the visit would cause the most concern? The client, option A likes to play baseball, option B drinks several carbonated drinks per day, option C has two sisters with sickle cell trait, option D is taking Tylenol to control pain. Correct answer is option A likes to play baseball. Next one is hypochromic and microcytic RBCs are seen in option A hemolytic anemia, option B pernicious anemia, option C iron deficiency anemia, option D acute blood loss. Correct answer is option C iron deficiency anemia. Next one is when obtaining assessment data from patient with a microcytic hypochromic anemia, the nurse should question the patient about option A folic acid intake, option B a history of gastric surgery, option C dietary intake of iron, option D a history of sickle cell anemia. Correct answer is option C dietary intake of iron. Next one is which of the following food enhances the absorption of an iron supplement? Option A, baked potato. Option B, orange juice. Option C, green beans. Option D, fortified milk. Correct answer is option B, orange juice. Next one is, which among the following is correct method regarding iron supplementation? Option A, take it along with milk. Option B, take it along with lemon juice. Option C, take it along with water. Option D, take it after having food. Correct answer is option B, take it along with lemon juice. Next one is, in India, which type of anemia is uncommon during pregnancy? Option A, iron deficiency. Option B, folic acid deficiency. Option C, vitamin B12 deficiency. Option D, iron and folic acid deficiency. Correct answer is option C, vitamin B12 deficiency. Next one is, the nurse understands that the most common type of anemia is option A, iron deficiency anemia. Option B, aplastic anemia. Option C, sickle cell anemia. Option D, pernicious anemia. Correct answer is option A, iron deficiency anemia. Next one is, anemia is commonly seen in following women. Option A, multiparity women. Option B, lower income group. Option C, childbearing women. Option D, all of other option. Correct answer is option D, all of other option. Next one is, most prevalent nutritional disorder among young children is iron deficiency anemia. A major reason for this in young children is option A, blood disorder. Option B, overfeeding of milk. Option C, lack of adequate iron reserves from mother. Option D, starting of solids early for proper absorption. Correct answer is option B, overfeeding of milk. Next one is, base test to detect iron deficiency in a client or in a community is option A, transferrin. Option B, serum ferritin. Option C, serum iron. Option D, hemoglobin. Correct answer is option B, serum ferritin. Next one is, iron is stored in the body as option A, ferritin. Option B, ferrous sulfate. Option C, transferrin. Option D, hemosiderin. Correct answer is option A, ferritin. Next one is, features of an iron deficiency anemia in children. Option A, weight loss. Option B, decrease in muscle strength. Option C, both B and D. Option D, decrease activity level. Correct answer is option C, both B and D. Next one is, all of the following are signs of anemia in a patient except option A, yellowness of the skin. Option B, tachycardia. Option C, dyspnea on exertion. Option D, lethargy. Correct answer is option A, yellowness of the skin. Next one is, a client has not had a bowel movement for 3 days. Which of the following medication may contribute to constipation? Option A, folic acid. Option B, iron. Option C, potassium. Option D, vitamin E. Correct answer is option B, iron. Next one is, jet track intramuscular technique is used in administering which kind of medication? Option A, dark colored medication. Option B, long term use medication. Option C, medication more than 5 ml. Option D, medication that have a long absorption time. Correct answer is option A, dark color medication. Next one is, What is usual site of IM injection? A nurse will choose in an adult for Z-track technique. Option A deltoid. Option B rectus femoris. Option C ventrogluteal. Option D vastus lateralis. Correct answer is option C ventrogluteal. Next one is the nurse is to administer an iron injection to an adult. How should this be administered? Option A SC in the arm. Option B interdermal in forearm. Option C IM in deltoid. Option D Z-track IM in gluteus. Correct answer is option D Z-track IM in gluteus. Thanks for watching. Like, comment and subscribe the channel.